Hi everyone, Laura here again for the second part of the lecture on therapy. Now that we've talked briefly about psychotherapy as a whole, we're going to break it down a little bit further. So the learning objectives for this part of the lecture are to be able to differentiate between types of psychotherapy, to understand the basics of each approach from a conceptual and theoretical framework, to understand how integrative therapies are formed, and lastly, to know how we select which type of therapy. So, I mentioned Freud, the father of psychoanalysis, briefly in the last lecture as what people traditionally think of when they think of therapy. And Freud is the father of psychoanalysis, which is the first type of therapy we're going to talk about. And so the idea in psychoanalysis is that problems are rooted in the unconscious mind. So in previous lectures, I think the personality lecture, Dr. Hansen showed you this image of an iceberg and pointed out the conscious, preconscious, unconscious, and how that relates to the id, ego, and superego as Freud defined them. So psychoanalysis treatment focuses on bringing repressed conflict into conscious awareness. So the focus is on the past. And while psychoanalysis is rarely used today, other therapies that have been derived in part from psychoanalysis are still widely used, such as psychodynamic therapies. So psychodynamic therapies focus less about sex and your id, ego, and superego, and focus more on identifying unconscious internal forces, the importance of early relationships, and important critical childhood experiences. So this could be used for treating depression, for example. If you are depressed and you feel like you're in a cycle and you don't really know how to break it, you can use something like psychodynamic therapy to recognize the recurring patterns in your life, kind of what leads you to that point every time where you end up feeling depressed. And then the idea being that you can adjust. The next type of therapy we're going to talk about is behavior therapy. So in previous lectures, Dr. Hansen has mentioned Pavlov, Thorndike, and Skinner. So Pavlov, think of the salivating dogs at the bell, and Thorndike and Skinner are kind of the cat mazes and work with rats and pigeons. So classical conditioning and operant conditioning are the basics of behavior therapy. The idea is that we can change behavior by using positive and negative reinforcement or classical conditioning. So if you can change the behavior, the emotions and moods will change too. This is the general overview of behavior therapy. We're focused on just the behavior. If you think about back in elementary school or even preschool, did you ever have a sticker chart for everyone in the class, and you got a sticker if you packed up quietly at the end of the day or something like that, or you had a pegboard that you got to move yours up towards the green or down towards the red, and then maybe at the end of the month, if you had so many stickers, you got to lead the class down the hallway for lunch, something like that. So those are examples of kind of behavior charts and token economies. The idea being that you can change the behavior by reinforcing. Behavior therapy is focused on modifying reactions and behaviors. So two ways that people do this is through exposure and systematic desensitization. So pretend you have an intense fear of elevators and you want to get over that fear, so you go to therapy. One way you could do it is through exposure or flooding, which is you're thrown into it and you just kind of experience it until you get over it. So kind of drastic. A lot of anxiety is caused in that process, but it's quick and it's effective. So perhaps you have a job interview next week on the 15th floor of a building downtown, and you don't want to walk up all the stairs in your nice suit and get sweaty, so you really want to conquer this before then. So in that case, you might pick flooding, just to get it over with as quickly as possible, and you'll deal with the anxiety just for the sake of time effectiveness. Another option would be systematic desensitization. So the difference here is that you're supposed to be in a very relaxed state before starting any of this, and you build up to facing your fear. So with the same elevator example, you might find a cargo elevator with your therapist. And cargo elevator is an elevator that opens on both sides. So you can block the doors of the elevator, both sides are open, and you might just stand in the middle of the therapist to start. And you can escape on either side. So a little bit of anxiety, but not terrible. And then you build up from there. So perhaps the next week you close one of the doors. Perhaps the next week after that, the therapist steps out, but one door's still open. And then the week after that, both doors close and you ride up one floor. And the idea is that you do each of these stages until they don't cause as much anxiety. It's just a level that you could deal with. So you work up to it incrementally. The next type we're going to talk about is cognitive therapy. And this is different from behavior therapy in several ways. So it's developed by Aaron Beck, and the idea with this is that changing the thoughts will change the related behaviors. So it's the thoughts that count. And cognitive therapy is focused on targeting maladaptive cognitions. So you have to think about what you're thinking about, essentially. It's a little bit of a metacognitive process. So some examples of maladaptive cognitions are catastrophizing, overgeneralizing, and dichotomous thinking. So these can spiral you quickly. And the idea is that you change your thoughts in a more positive manner so that you can deal with these negative thoughts that you might originally experience. So an example of catastrophizing, say you have a big exam tomorrow, and you think, if I fail this exam, my life is over. Clearly that's not true, but that's what it might feel like in the moment. Overgeneralization could be, well, I failed the last exam, I'm going to fail this next exam, which also might not be true. Maybe you got no sleep before the last exam and that really impeded your progress, so maybe it's completely different this time. Or dichotomous thinking, so maybe you think, I can either get an A+ on this exam or I failed it. Whereas that's not really true. You could easily get a B and be fine. So just kind of changing the way you think about these things and identifying them in yourselves and fixing them in the future. So now that we've gone over 3 basic types, we're going to talk about some integrative therapies, which take the best elements from these previous ones we've talked about and combine them. So the most common one is cognitive behavioral therapy, which is used to treat anxiety or depression. So the idea with this is that you take the cognitive side from cognitive therapy, the behavior side from behavior therapy, and you use it all together. So with the same elevator example, you might think, or you might go and you might do the systematic desensitization with your therapist, but you might supplement that with some cognitive thinking. So you might think, as a therapist, you might ask the client, well, what do you think is going to happen if you get in the elevator? Like, what's your worst fear? Why does it scare you to do that? And they might give you some examples, and they talk about, well, what's the chances of that actually happening? You might even supplement that with some statistics of chances of doors locking in an elevator or something like that. And you kind of think about it, or you target it from both sides, from the behavior side and the cognitive side. Another example is dialectical behavior therapy. And this is an adaptive form of CBT, which incorporates mindfulness and acceptance. And it's typically used to treat borderline personality disorder. Another example is interpersonal therapy, which is used to treat anxiety, depression, or even eating disorders. And it's based on attachment theory and forming interpersonal relationships. So improving the interpersonal relationships in your life so that you feel more connected with others and feel less depressed and isolated, for example. So lastly, some things to consider when we're developing a treatment plan or trying to select a type of therapy to use. We want to think, what is the presenting problem? As I mentioned at the end of the last lecture, these are all evidence-based practices. So we have the research that says this type of therapy works really well for this problem, and it's effective and it's efficacious. And so we're like, okay, that's a good place to start. We might also consider the client. So what's their personality? How old are they? What are some other factors about them that might play in? Maybe they're very religious, or maybe they are very shy. Different things like that that might play a role in the therapy and might shift the balance from one type to another. We also want to consider what resources the clients have. So how much money do they have? Time, social support. If they don't have much money, you don't want to give them homework assignments that require them to go out and do something social each week or something like that. You want to be respectful of all these different things that we're considering. Time, for example, I mentioned with the elevator example. If you have that job interview next week, you don't have the time to go through 6, 7, 8 sessions of therapy and to build up to it. You just want to get it over with. So that would shift the balance from systematic desensitization to flooding. And lastly, you want to consider intellectual ability. if you're working with someone who is who has an intellectual disability, you are unlikely to do cognitive therapy with them, because in order to do cognitive therapy, as you know, you have to think about your thoughts and have that metacognitive ability. So that perhaps is not the best option here if that's an area of deficit. So you might lean towards behavior therapy. Well, that is the end of this lecture. I hope you guys enjoyed it. I hope you learned something interesting, and good luck with the last assignments in the course.